Medical experts have sounded the alarm over the state of the nation's intensive care units, saying they remain vulnerable to another COVID wave. The Australian and New Zealand Intensive Care Society has singled out Queensland as having inadequate ICU capacity. Joining us live now is the health editor of The Australian and The Weekend Australian, Natasha Robinson. Good to see you. It's not the sort of news, obviously, that states will be wanting to hear, just as some are considering open up or are opening up this week. How worried should we be, and in particular, how worried should Queenslanders be?
Yeah, look, Queensland has been singled out as the state that is the most vulnerable were there to be a pandemic wave there, which isn't out of the question, of course, as things start to open up. It's been revealed in a new report, which is the biggest data set of health performance in the country, that Queensland lacks capacity for demand. There's concern for the rest of the country as well, despite all we've done throughout the pandemic to bolster ICU units and surge capacity. It's public hospitals that have been singled out as well. And this report does show, though, that hospital performance has generally improved over the past 8 years in many clinical indicators, including emergency departments. But some of the more urgent cases in emergency departments are still waiting too long to be seen. They're not meeting those benchmarks. And in particular, mental health patients are waiting inordinate periods of time in emergency. Only, around a third get admitted if they need a hospital bed within 4 hours, and many are sitting in emergency for very long periods of time. So that's a real concern. But one of the other interesting factors as well is that the vaccination rates for the flu vaccine have increased really, really markedly among healthcare workers. So in 2016, the rates were about 55% of healthcare workers vaccinated against the flu, and that rose to about 88% last year. I think there was this huge push to make sure that hospitals weren't overwhelmed with flu as well as COVID. So that's really good news, and of course means patients are less likely to, contract flu from a healthcare worker as well.
We all like a good news health story, especially in these times, Natasha. And I did see that one of your reports this week looked at fatality rates for some major diseases. And it does seem that, very broadly speaking here, if people do contract heart disease, cancers and other infectious diseases, statistically, they're now less likely to die.
Yeah, the rates of coronary heart disease have dropped quite substantially. It's still the biggest killer in Australia, but it's really heartening to see those rates go down. And I dare say that a lot of that has to do with, the quite large decreases in the number of people who smoke. I think it's really, really unusual for young people to smoke now. It's those numbers among young people have dropped. I think it's something like around 16% of young people, which is just, obviously still too high, but a really big decrease from where we were even 5 years ago. So that's really heartening. So I think into the future, those rates of heart disease hopefully will continue to drop. And some of the things that went up, though, there's much more people suffering with back pain for some reason in the last the latest stats are from 2018, so that was a big increase. And the rates of dementia are also going up. And I think we spoke about this last week, some of the things you can do. Drinking coffee might help, but I think the single biggest things you can do, obviously the risk is just age. That's the major factor in dementia, but there's so much evidence coming out now that exercise has such a protective role. So that's one of the single most important things that you can do, and also lowering your alcohol intake, because there's a really direct connection between excessive alcohol intake and dementia. So hopefully we may see those rates start to decrease, but I think as well as people are living longer, it's probably going to be a significant burden of disease into the future.
The demographics would certainly suggest it. Natasha Robinson, appreciate you joining us as always. Thank you.
Thanks, Ash.